So what I want to talk about is a phenomena that happens after someone has their atlas corrected, which we call retracing. So retracing is how your body goes through the healing process. And so let's just give you a scenario. You're 6 years old and you're playing soccer and you get kicked in the head with a soccer ball. It knocks your atlas out of alignment. There's an adaptation through the spine. There's consequences due to the interference on the spinal cord, and your body does the best that it can to adapt to it, and maybe you have a little neck pain off and on, and then you're fine symptomatically. And then when you're 12 years old, you take a baseball in the face when you're warming up for a game, which creates another atlas misalignment, which creates more damage to the soft tissue, which causes a new adaptation through the spine. And then when you're 18, you start to develop migraine headaches once in a while. And at 22, you get in another car accident. And by 28, you have headaches 3 times a week, and your right shoulder is persistently bothering you, and you have numbness and tingling down the left arm. And 2 years later, you develop sciatica and low back pain. And then you walk into an upper cervical doctor's office at age 40. So through that process of injury that you sustained over the years, there was an adaptation, like I said, through the spine, and there's different symptomology that happens due to that adaptation. And so you come into an upper cervical office and we run objective tests on you, and then we find out which vertebra's off, and we take some x-rays and we find out exactly how the vertebra's locked out of position. And we make a specific correction to get that vertebra that's locked under the skull back where it belongs. And once that atlas is back in motion, the pressure has been removed off the spinal cord, the body is going to retrace, or it's going to heal back through all of the old injuries that have happened. So as long as the atlas stays clear, there's a healing process that goes on. Your body's going to reverse the order of damage that's been done in the body. And of course that takes time. And so in our office, we always educate patients that there are repair cycles that happen at the 4th through the 6th week, the 3rd month, the 6th month, and the 9th month. And in between those periods, we call them rest phases. So the body will rest, it will repair, and then it will rest, and then it will repair, and then it will rest and repair. And so there's a sequential, chronological healing process that takes place over time. Yeah, we wish that healing took place overnight. And many patients get a lot of symptom relief rather quickly, but there's also others who throughout their healing process they pick up these old injuries and symptoms that they had. So retracing is not only structurally the spine retraces, as the nervous system functions better and as it goes through that healing process and it picks up old injuries that happened to you when you're younger, you may re-experience some of those old symptoms, you may re-experience some of those old pains temporarily as the body goes through that process. So that's a little information on what retracing is, and we'll make a few more of these videos talking about other things that happen while people are under upper cervical care.